As Wendy mentioned, I'm Pete Wilson from Alpena Agency. I'm the Executive Vice President here. I've been in the insurance business about 25 years, becoming a co-owner of the agency in 1995. And with us is Dave Zeller. Dave has a few more years experience in insurance than I do. He must be into the 30 plus years. The purpose of today's presentation is to try to give you an overview of Medicare and understanding of its different parts, and hopefully give you some insight on how to make the decision on what additional coverage you may want to purchase to augment the original Medicare. So we'll go through all the components here. It's going to take about 25 minutes. So first of all, on this slide, what I'm showing you on the right-hand side, this is Medicare. There's parts A, B, C, and D. A and B are your original Medicare that you're all familiar with. That's the part that's provided by the federal government that you've earned through all the years you participated in Social Security. C and D are additional parts that were added later. On the left side of the screen is what we're calling our Medigap or Medicare Supplements. And these are add-ons to Medicare to provide additional coverage for you to fill in some of the gaps, hence the term Medigap, within Medicare itself. But the term Medigap or Medicare Supplement are the same thing. They're synonymous. A Medigap policy or a Medicare Supplement are the same thing. So don't let that confuse you. So let's get started and we'll go through each of the parts. First of all, Medicare originated in 1965 by President Lyndon Johnson. And as I mentioned, this was comprised of two parts, A and B. Part A is your hospital coverage, when you actually go to the hospital for a surgery or overnight or week or a month. Part B is your outpatient care. That's for care that doesn't either require an overnight stay in the hospital or is within 24 hours you're in and out. And in fact, many of your surgeries, as you're familiar with, are outpatient surgeries. So A is hospital, B is outpatient. Outpatient would also include doctor visits, etc. Later, after A and B were created, additional parts were added to Medicare. Part C, which are Advantage plans, and Part D, which is the prescription drugs. And as we go along, I'm going to go through each of these components. A and B, that's your original Medicare. Now, anyone who is 65 or older in America or is a permanent resident that's been here at least 5 years is eligible for Medicare. The other people that are eligible for Medicare is someone who's qualified for Social Security disability for 24 months also becomes eligible for Medicare. One thing to keep in mind is when you turn 65, you become eligible for Medicare, even if you choose not to take Social Security benefits. So some people will delay their Social Security benefits for a few years, but they're still eligible and should and can sign up for Medicare. So the original Medicare is parts A and B. Now, these parts are provided to you by the federal government. You enroll in A and B through the Social Security office. So this is directly through the Social Security office or online through the Social Security office. This is how you're going to roll at A and B. You're eligible for A and B the first day of the month when you turn 65, or earlier if you have Medicare due to disability. But generally speaking, when you turn 65, you're eligible for your A and B. And you can sign up to 3 months in advance. So many people want to sign up early. They've got a lot going on, and that's available. So where's the cost incurred for Medicare? Part A is free to most people. That's your hospital piece. So Part A is hospital. And it's free to most people as long as you or your spouse have worked at least 10 years in the United States and have paid into the system. Part B, which is your outpatient, your doctor visits, Part B depends on your income. Starting in 2021, the base rate for Part B is $148.50. But as I mentioned, Part B does depend on your income, so rates can vary for some people. The base is $148.50, but can go all the way up to $504.90 a month if you're a high earner after you turn 65. Once Social Security has determined what you're going to pay based on your income, that bill is deducted from your Social Security check. So some people kind of forget over the years that they're actually paying for their Medicare because it is deducted out of their check each month. If you delayed enrolling into Social Security, in other words, you're not getting a Social Security check yet, but you're enrolled in Medicare, then they will bill you for your Part B on a quarterly basis. So let's break down Part A. What we want to do for the next minute or two is I want to show you what each of the original Medicare parts pay for and what they don't pay for. And then we'll talk about the Advantage plans and the supplements that are going to fill in those gaps. So Part A is your hospitalizations. First thing is Part A has a deductible in 2021 of $1,484. If you go into the hospital and you have Part A, your first 60 days, you have full coverage. Medicare is going to pay all the bills. However, if you're in the hospital for more than 60 days, you're actually going to have an out-of-pocket cost of $371 a day. So that next 30 days, from 61 days in the hospital to 90 days, you would owe $371 a day out of pocket, which equates to over $10,000 in bills. If on some chance you're in the hospital for even more than 90 days, Medicare will continue to pay a part of the bill. However, you're going to now owe $742 a day. There's a limitation then. If you've been in the hospital for 91 days, Medicare will pay the cost except the $742 a day, but only for an additional 60 days over your lifetime. So after 91 days, there's a 60-day cap, and that's the most Medicare will pay over your entire life. So if you went in and out of the hospital for 3 or 4 different times, and you were there in a long stay beyond 90 days, you could use up that 60-day maximum throughout your life at different intervals, and eventually you would have no coverage if you go to the hospital and you're there for more than 91 days. Now, keep in mind that, number one, being in the hospital for more than 60 days is very unusual, but it does happen. Also, if you're in and out of the hospital and you're out of the hospital for more than 60 days, your hospital stay will reset and you'll start all over with full coverage again. So say you go into the hospital in March and you're discharged and you go again in November. Since more than 60 days has occurred in between hospital stays, you're going to start over again with this 0 to 60 day full coverage. Okay, so I don't want to make everybody nervous about this. You do get this first 0 to 60 days of full coverage, and it does reset every time you're out of the hospital for 60 consecutive days. However, this lifetime maximum, if you have long hospital stays, that last 60 days they're willing to pay for in your lifetime maximum never resets. That is the maximum. So right here you can see where there could be significant out-of-pocket costs should you be in the hospital for an extended period of time. And this is one of the reasons that the supplemental coverage or the Advantage plans were invented or created in order to protect you from these expenses. Another part of coverage A is skilled nursing care. Think of this as rehab. You've been in the hospital and now you need to go to get some nursing care for the next 10 days or 30 days to rehab you to be able to live alone again. The first 20 days of that rehab is covered by Medicare Part A 100%. But if you need rehab for more than the 20 days, then 21 to 100 days, you pay $185.50 a day. If it goes beyond 101 days, you have no coverage. Medicare Part A is not a long-term care policy. It's not a custodial care. The idea is they're going to give you some benefits. If you're in the hospital, you get sent home or you're sent to nursing care for a limited stay to rehab and get you back on your feet. this is what they pay. You could still, though, owe $185 a day if it exceeds more than 21 days. Again, a supplement or a Medigap policy or Advantage plans are what's available to fill in this gap should you need longer nursing care or more rehab than what's shown here. A couple other parts of Part A. You will get some home care, but you must meet certain eligibility requirements. It's not a homemaker service. They're not going to pay to have somebody come into your house to do the dishes or that sort of thing. It's not custodial care. Hospice care is a benefit that you are getting with Part A. And if you meet eligibility requirements, it can be a really important coverage for you. So hospice care is available to anybody on Medicare, and you don't need to wait till the last minute in order to access hospice care. When someone is severely sick or terminally ill, the idea is this hospice care is available early on in this prognosis, and typically the benefit's 100%. So hospice care is a really great benefit of Part A that people need to be aware of and to take advantage of. One of the things to remember with Part A, there's no coverage outside of the United States. So if you're traveling in Europe or Canada or Mexico, you don't have any health coverage provided to you from Part A. Okay, so Part A is original Medicare. That's our hospital coverage. Now let's take a minute and talk about Part B. Part B is what we're calling the outpatient care. So Part B is your doctor visits, your lab work, your image test, your outpatient surgeries, durable medical equipment, chemotherapy, radiation, dialysis, ambulance services, also some home health care, which is limited. Now, Part B has an annual deductible of $203. Part B basically covers 80% of all your outpatient services, and you pay the other 20%. But there's no out-of-pocket maximum for that 20% you pay. So if you're going to be participating at a 20% level, but unlike standard coverage you might be familiar with when you didn't have Medicare, there is no out-of-pocket maximum. You're going to pay that 20% as much as it becomes. Keep in mind, many surgeries and cancer treatments are often considered outpatient services and would fall under coverage B. So you're going to pay 20% of that bill for any of these outpatient surgeries or cancer treatments that are considered outpatient surgeries. This is where the supplements and the Advantage plans really can be very, very important to cover these out-of-pocket expenses. One of the questions we've heard a few times is Part B necessary? Part B is required if Medicare will be your primary insurance at age 65, so you have to buy it. You can't purchase any of these supplemental policies unless you have both A and B. Also, if you're actively working for a large employer and you've retired from a large employer, often Part B can be part of that large employer's insurance that they provide to some of their retirees. And then once you exit that plan, then you could delay and purchase your own Part B. So in summary, basically Part A and Part B, they provide a widely accepted inpatient and outpatient network. Go anywhere in the United States. However, they do have those limitations that we talked about. Hence, these Part C was created, these Advantage plans, Part D, prescription drugs, and also the Medicare supplements or Medicare plans. So I'll get into the second section. Is there any particular questions about the A and B part?
Pete, I don't have any questions in the queue either.
Okay. So let's take a minute now and talk about Part D. So A and B is your original Medicare. Keep in mind, there's nothing in original Medicare that's going to pay for your prescription drugs outside of the hospital. If you're in the hospital and you get prescription drugs, that's included. Part D is to pay for retail prescription medications that you pick up at the local pharmacy or via the mail order. So traditional prescription drug coverage. These plans are purchased through insurance companies or agents. So Medicare, original Medicare A and B, you got through the Social Security office. If you want a Part D, a prescription drug coverage plan, you purchase it through a private insurance company. You do not need any supplement. You don't have to buy a Medigap or a supplement in order to get Part D. You can buy Part D on a standalone basis. Part D has built-in copays for medications, so you don't have to pay 100% of the cost. That's the purpose. You're eligible to purchase Part D when you turn 65 during an open enrollment at that time, and then there's open enrollment right now, as we mentioned. So right now, between October 15th and December 7th each year, we have this open enrollment period. And during this open enrollment period, up until the 7th of December, you can buy a Part D plan if you don't have one right now. This is the time to do it. The last thing about the Part D coverage is, if you don't have prescription drug coverage right now, and you haven't purchased a Part D plan, and you decide 5 years from now that you're going to buy a Part D plan because now you need the coverage because you are on prescription drugs, even though you weren't when you were younger, there's a penalty they charge you for delaying that purchase. So there's an advantage of purchasing a Part D plan early in your retirement, even if you're not on a lot of prescription drugs initially. So what does Part D cost? Part D has varying premiums. So there's lots of different choices of plans out there. They have different copays you may be familiar with. You pay so much for a copay on a generic drug or on a name brand drug, and those things vary. And with all these different plans, you want to take a look at what drugs you're on in order to decide what plan is best for you. The national average premium for a Part D plan is about $35 a month. And as I mentioned, each plan has different drug formularies. So for instance, you could be on a particular name brand drug, and that brand may be in one formulary for one company and a different formulary for another company. So say one company could say you have a $55 copay, another company might say you have a $100 copay, and a third company may not cover that drug at all. So it's really important when you're trying to consider what Part D plan to buy that you have a list of your prescription drugs available to you, so you can type them into the computer or have your agent type them into the computer and see how that Part D plan is going to work with your medications. Now, your Part D premiums get paid directly to the insurance carrier. However, you can request Social Security to deduct them from your monthly Social Security check if you want. If you have a high income situation in retirement, there could be an additional cost to your chosen Part D plan. Okay, I mentioned the penalty, and I just want to point this out. So what we're saying, what they're requiring is if you do not purchase a Part D plan initially when you turn 65 and you don't have coverage anywhere else, you're going to pay a 1% penalty based on the average cost of that prescription drug coverage in the United States for the number of months that you didn't purchase the plan. So real quick, if the average monthly cost is $35, a 1% penalty is only 35 cents a month. However, if you waited 10 years to purchase a prescription drug plan, that's 120 times 35 cents or over $40 a month penalty. So by waiting 10 years, your prescription D plan is going to be the base price, say it's $35, plus the penalty, say that's $42. So now it becomes $77. So it's really important to consider this Part D plan, well, even if you're not on prescription drugs right now. Let me talk a minute about the donut hole. The donut hole can be a little confusing for people. So the donut hole applies to Part D plans, and it applies to your prescription drug copays. So when you buy a prescription drug plan, a Part D plan, it's going to have a deductible. Typically, the deductible is around $445, but that varies with plans. So first off, you're going to pay until your deductible is paid up, $445. Then after the deductible has been met, you're going to go into a situation where you're going to pay these co-pays, such as your $10 for generic drugs, or $45 for a formulary drug, or 50% of the bill for a high formulary drug. Whatever your co-pays and co-insurance is of your plan, you're going to pay that after you pay your deductible. And when you've got to the point where you've paid in another $4,130, this is where you enter the donut hole. In the donut hole, you're going to pay 25% of your prescription drug costs, whatever that may be, until you've paid out a total of $6,550. So you pay your deductible, then you pay your co-pays, then you enter the donut hole and you pay 25% of your prescription drug costs, no matter what, till you get to the $6,550. Now you've exited the donut hole, and after that, you're going to only pay 5% of your prescription drug costs with a cap included. So that's the donut hole. After deductible, after copays, you enter this $2,500 range where you're going to pay 25% of your prescription drug costs. That's where the donut hole fits in. Does anyone have any questions about the Part D?
Pete, I don't have any questions in our chat box, but just a quick reminder for everyone, if you do have questions, feel free to type them in and we'll make sure Pete covers them.
Okay, let's go on to the next thing, which is the Advantage plans. So we talked about Part A and B. That's your original Medicare. We talked about Part D, which is the separate prescription drug coverage that's available. Medicare Part C is what they call Advantage plans. And now think of Part C as sort of your traditional Blue Cross or Priority Health, a traditional medical insurance plan, health insurance plan that you're familiar with. When you purchase a Part C plan, you're purchasing it from an insurance company, a private insurer, and they're going to wrap in A and B and C are all one part. And in most cases, they'll include Part D. So when you buy an Advantage plan, a Part C plan, it's going to be A, B, and D all together from one insurance carrier. You purchase a part or an Advantage plan, you purchase this plan from an insurance carrier or their agents like Alpena Agency. So Alpena Agency sells Advantage plans. And these Advantage plans encompass Parts A and B, but in addition, they include a lot of the gaps that we talked about that A and B have. These are an alternative to a Medicare Supplement or a Medicare Medigap plan. So you have A and B, which is your original, and then you can either get a Part C Advantage plan to enhance your coverage or a Medigap plan or a supplement to enhance your coverage. Not both. You go down one path or the other. The premiums, though, for an Advantage plan are as low as $0. So you can purchase a Part C plan, an Advantage plan, with $0 premium. I know people have been getting inundated with paperwork, solicitations, TV shows saying you can get a premium that's $0. And most of us immediately think, well, that's not true. But it is true. So Advantage plans premiums range from $0 to about $300 a month. You still have to pay your Part B premium. You still pay that separately. But the Part C is going to have this premium of $0 to $300. Part C, again, works like a traditional health insurance policy, in where you have a network of providers. Depending on which plan you go with, those providers are going to be a broad network in the state of Michigan. They can include out-of-state coverage, etc. But it's going to have a network of providers. Part C Advantage plans could be an HMO, they could be a PPO, they could be different types of plans underneath. But again, it's a lot like traditional health insurance. You're eligible to purchase this Advantage plan when you turn 65, or right now during open enrollment. So right now in open enrollment until December 7th is when you can buy these Advantage plans. And if you don't take advantage of it during this open enrollment period, you have to wait another year. So if you're out there or you have friends that have Medicare A and B, but they haven't purchased a supplement and they haven't purchased a Medicare Advantage plan, they can buy a Medicare Advantage plan during this open enrollment period for 0 premium. It's going to fill in some gaps of coverage. We'll go over that in a minute at 0 premium. So there's really missing out on something when people aren't taking advantage of that particular plan. There's other plans to choose from, and if you talk to your agent, they'll go through those. And we would at Alpena Agency go through all the different Medicare Advantage plans for you, but I want to point out the 0 premium one because it's such a good opportunity. These plans are not medically underwritten. So if you have health issues, you're still eligible to get an Advantage plan in all that extra coverage they're going to provide. So let's look at that. So your Medicare Part C, your Advantage plan, they're going to have a low deductible or no deductible. So where Part A and B have a deductible, an Advantage plan is going to have a low or no deductible. An Advantage plan is going to have low or no copays or low or no co-insurance. And the big one is with a Medicare Advantage plan, there's an out-of-pocket maximum, usually between $4,100 and $5,500. So when we looked at Part A, where we said, well, if you're in the hospital more than 60 days, you have to pay that $352 a month. That could add up to $10,000 real quick. Here, it would be maxed out at $4,100 or $5,500, depending on the plan you picked. Similarly, on your Medicare Part B, where you have 20% copay for your outpatient services with no maximum out of pocket, again, this maximum out of pocket is going to come into play. So if you have a serious medical condition where you spend some time in the hospital, then you need some outpatient surgeries, a lot of follow-up visits, all that out of pocket could add up real quick. This Medicare Advantage plan is going to cap that out-of-pocket cost at these numbers. That's where if you have A and B and no Advantage plan, you can get an Advantage plan with 0 premium and have that benefit. Most plans also include a prescription drug coverage benefit. So in addition to these benefits, you're going to get the prescription drug coverage or the Part D benefit. Most of them also include dental coverage, where you can go to 2 dental visits a year for cleanings, and the Advantage plan is going to pay the premium for that or pay the cost for that. Or a vision. Usually there's at least one vision included. And some of them have wellness benefits. So there's a lot of benefits there. Emergency foreign travel coverage is included under Parts A and B, no coverage outside the United States. As part of this plan, you would have coverage up on a reimbursement basis for an emergency. Again, it's not a long-term care policy. It's not going to provide custodial services over years and years. And they also do, though, provide some managed care services where if you have a serious health issue and you need some help navigating through all of the different hospitals and doctor visits and so forth, most of these Advantage plan carriers have staff available. You can call a nurse and they'll kind of help you make appointments and walk you through what you need to do. Okay. Those are your Part C's, your Advantage plans. That's one option to go with to fill in the gaps of A and B. One option to fill in those gaps, you get an Advantage plan. The second option is to go with the Medigap plan or Medicare Supplement plan. These plans leave A and B alone. You're still going to file your claims or still going to go through A and B in the federal government. But then the supplement's going to sit on top of them and pay after A and B have paid. So whatever A and B doesn't pay, then the Medigap plan steps in and starts to pay. These are also purchased through a private insurance carrier like Alpena Agency. So we would sell Advantage plans and supplements. So we could compare one or the other for anybody who's interested and they're not sure which way to go. The premiums for the supplements tend to be a little more expensive, from $100 to $500. One disadvantage of the supplement is it's age rated. So you buy a supplement when you turn 65, but as you're getting older, the bill is getting bigger and bigger and bigger and bigger. So a lot of people find as they get older, they might want to move out of the supplement and into an Advantage plan. Coverage for a Medigap plan doesn't have its own network. Its network is the Medicare network. So basically anywhere Medicare is accepted, your supplement's accepted. You're eligible to purchase these supplements when you turn 65, and at that time, they're not medically underwritten. So when you turn 65 and you want to buy a supplement, there's no medical underwriting. However, when you want to switch plans later after the first year, they become medically underwritten. So while with a supplement, you can change outside of open enrollment. It's not restricted to open enrollment, but when you change a Medicare supplement from one Medicare supplement to another, they're going to ask you health questions. So if your health has deteriorated over the years, you may not have the opportunity to move into a new supplement at a reasonable cost. They'll do a medical underwriting and they may charge more premium if your health isn't what it was when you started. Similar to the Advantage plans, supplements has a lot of times no deductible or very low deductible, no co-pays, no co-insurance. They extend your hospital stay coverage to $365, 365 days. So they do fill in a lot of those gaps that we talked about. They don't include prescription drug coverage though. So if you buy a Medigap, a lot of times you're going to buy Part D separately. So where a Part C, the Advantage plan, included A, B, C, and D, supplements don't. Your A, B stands alone, you buy a supplement, and then you would buy Part D for the prescription drugs. These plans, the Medigap plans, they don't usually include any preventative dental coverage or vision or wellness like the Advantage plan. So you're not still going to pay out of pocket to go to your dentist or your vision. Emergency foreign travel coverage is often available, but limited to an 80-20 split. So you would pay 20% of the bill. They would pay 80% of the bill up to $50,000. And similar to the Advantage plans, this again, it's not a long-term coverage, long-term care coverage. This is not custodial coverage. Okay, so let's look at this. So here I'm showing on this slide how it works. You have original Medicare, okay? That's your Part A and B. After that, then you choose, do you want to go to the Medigap or the Medicare Supplement, or do you want to go an Advantage plan to a Medicare Advantage plan, okay? So one is Part C, which is your Advantage plan, or you go with a Medicare Medigap plan. Those are kind of your two choices to augment your A and B coverage. So let's summarize your two choices here. This is just generalizations, okay? Generally speaking, when you buy a Medigap plan or a supplement, you're going to pay a higher premium, but when you go to the doctor or you go to the hospital, you're almost going to have no cost out of pocket. So it's sort of like you're going to pay a monthly premium up front, but then when you do use the coverage, you don't pay a lot out of pocket, if any. A Medicare Advantage plan, you're going to have a lower premium, as low as $0 premium. But then typically you may have a $10 or $20 copay when you go to the doctor, or when you have, you might have a small deductible to start out the year with. So Medigap tends to be more expensive, but more less out of pocket, where the Advantage plans have a lower premium, but then you pay a little bit along the way if you actually use it. Medigap, you can go to any doctor that accepts Medicare, where an Advantage plan is going to have a network. Now, don't let that worry you too much, because the networks are usually very broad. Similar to like a Blue Cross policy, where almost everyone participates in the network. The only thing you might run into with an Advantage plan is if you spend the winters in Florida, you might have to come back to Michigan if you want to get knee surgery or shoulder surgery or something like that. If you have an emergency, it's not a problem, but a regular surgery, you're going to need to be within the network or get an exception to go out of the network. Medigap, no referrals necessary. Advantage plan, sometimes if you get the HMO plan, you would need to have referrals to go to a specialist and so forth. Medigap, there's no routine services provided. As we mentioned, preventative dental or vision, where the Part C's, the Advantage plans do include those benefits. In the Medigap, you get coverage anywhere in the US, very limited overseas. That's kind of similar to the Medicare Advantage plan as well. The last thing is, that's not on this slide, the Advantage plan, the Medicare Advantage plans often include Part D. In fact, almost all of them include Part D. Medigap, you're going to have to pay for a Part D coverage. So, kind of the summary of what we're talking about. I just want to reiterate that the open enrollment is occurring right now, so you have till December 7th if you want to make a change. It's really important to talk to somebody about your individual situation. As Wendy had mentioned at the beginning, here at Alpena Agency, we do have 3 Medicare certified agents, and they're available either by phone or you can make an appointment if you want to come in and you're comfortable. I'll look into a Zoom meeting, whatever works for you, and they can discuss the differences between the Advantage plan, the Medigap plan, and the Part D plan for your own specific situation. So if you're on certain prescription drugs or you have certain medical conditions, you'll be able to look at those specifically. We have appointments available, either phone, in person, or Zoom. That's pretty much going to cover most of what I wanted to talk about today. Are there any additional questions?
Pete, I don't have any questions in the chat, but if anyone has any questions, feel free to ask right now if you're comfortable. Pete, you might want to stop sharing your screen for a moment.
So on the supplement.
Okay.
Yeah. Go ahead and ask.
Yeah, I have a question in the first one. What's that? The Advantage. Like for vision or dental, does it have to be in your area? I mean, what's the area? We're talking, is all of Michigan, northern Michigan?
Typically, each plan has its own, each plan has a network, and there's a number of different providers. So there's Blue Cross, Mutual of Omaha, there's Humana, there's Priority Health. Most of them, though, if you're in the state of Michigan, it's going to be anywhere in the state of Michigan you can go, and most of the networks are pretty broad. Isn't that right, Dave?
Yes, and if you're going with Blue Cross, it would be the Blue Cross network for the vision and dental. If you're going with Priority Health as your Medicare Advantage, they use Delta Dental for their dental and iMed for their vision coverage. So anybody that accepts those in the state of Michigan, you would have coverage.
And I had a question too in the Medigap ones. You said it increases as you age. What typically does it go up a year? Is it, we're talking a couple dollars or?
The one I'm seeing, it could be 10, 20 bucks a month. Isn't that what you're seeing, Dave?
Yeah, and it varies by company. And of course, their experience that they're having with their Medicare clients. But yeah, it'll range anywhere from $6 to $10 a month that we've been seeing lately.
I mean, I've seen one, some, this $500 a month, and if you get in your 80s, I think we saw a couple prices in that range. So as you get older, you're seeing this, and I guess you need the coverage more than ever, typically, but the price for that monthly price is going up, and we are seeing a certain number of people move away from the supplements into the Advantage plans as they get older due to that monthly cost.
No, but then you say if you go from the supplement to the Advantage, then they look at your medical history, right?
Actually, it's the opposite. So if you go, an Advantage plan has no health questions. So you can enter an Advantage plan anytime during open enrollment. So if you're on a supplement right now, you can go to an Advantage plan, or you can go from one Advantage plan to another Advantage plan during this open enrollment period with no health questions. The supplements are the ones that are medically underwritten. So if you want to go from one supplement provider to another, or one supplement within the same provider, they're going to medically underwrite you. So what happens is that precludes a lot of people when the price gets really expensive. They can't really go from one supplement to another if they have health issues. And they'll end up going to an Advantage plan because it doesn't have any health
Okay.
underwriting.
Okay.
We're sort of
What about
seeing-
going,
I was just going to say, we're
what about
sort of seeing.
Advantage?
I'm sorry, Wendy, go ahead.
What about going from an Advantage plan to a supplement?
So
You
you can
then
go-
are medically,
Yeah, yes. So if you go from an Advantage plan to a supplement, that supplement is still going to be medically underwritten. So, one thing you could think of, well, when I turn 65, I can purchase a supplement and there's no medical underwriting for that first time. And that's an opportunity to get in there without any medically underwritten. And then each year after you're in it, the price is going to slowly go up as you get older. And then you could switch to an Advantage plan later when that price is too expensive and it's not medically underwritten. So that's kind of the difference there. We are seeing, I think the trend we're seeing is more people are going to the Advantage plans now compared to even just a few years ago. They seem to be, the plans have a pretty good coverage broadening over the years. And we are seeing people moving in that directions because of the low price on a monthly basis, and you only pay as you go as far as your co-pays and deductibles.
We go to Florida for 3 months in the winter. Let's say I need just to go to a clinic or a doctor down there, not knee surgery or something. Would that be paid for, under the Advantage?
I'll let Dave field that one.
Well, emergency care and urgent care are covered anywhere in the country. So if you had the common cold and you just went to a primary care physician, you're going to pay your out-of-pocket expense there yourself. But we do have some plans that are designed for those people that go out of state, and they are allowed 4 visits to a primary care physician above and beyond the emergency care and the urgent care plan.
And the Advantage plan doesn't go up with age then, right?
The Advantage plan does not increase with age. They do have some overall increases by the plan itself. So if there's an 88-year-old, a 75-year-old, and a 65-year-old on the plan, they're all going to pay the same price, but the plan itself may increase.
Okay.
And just to say that we've seen increases, but they're minimal increases. So the coverages are not jumping up $25, $30 a month. And the zero premium plan is always going to be a zero premium plan.
Okay.
And we've been actually, I use the word, it's funny to use the term selling a zero premium plan, but we've been selling a lot of those plans for people just even because the coverage within them is really pretty good. So just don't let the zero premium turn you off and thinking nothing's free. What's happening is, as part of the money you've paid in to Medicare all those years, the government has now subsidized this Advantage plan with zero premium. So the insurance company is getting reimbursed by the government for the plan that you purchased at zero premium. And even the other Advantage plans, a lot of those have $25 a month premiums, $18 a month premiums, $40 a month premiums. They're all pretty inexpensive. And the reason is because behind the scenes, the federal government is still putting money into that plan for you. So it's sort of subsidized on the back end. But this is something, we have all been paying for. So it is a benefit that we've earned all these years. So it's an opportunity. And what we want to make sure is people who only have A and B, and there's a number of people out there with only A and B, and they don't want to spend any more money. Their budget's very tight. Totally understand that. Get the zero premium Advantage plans in, and at least have that in your back pocket if you need it.
Okay.
Well, I appreciate all of you joining us today. I hope we did answer your questions. Again, Dave's going to be available to take calls and or face-to-face appointments, we have Mark Boyk here, who's also been with us been in the business for 25 plus years. We have Tanner Kostelik, who's new to the office, but he's fully trained in the Medicare Advantage and Supplement plans and be more than happy to sit down and talk to you about your own individual circumstance. Now's the time to take advantage of it. That's the big thing, because once the open enrollment closes, then you're sort of stuck where you're at for the remainder of the year, up until next year.
Pete, there is one more question in the queue.
Yes.
And that is, what do we consider medically underwritten? The health insurance questions on the Medicare or Medicare gap policy has things like, have you had surgery in the past 2 years? Have you had a heart attack in the last 5 years? What kind of medications are you taking? Those types of questions are asked when you are switching from one Medigap plan to another, should you want to go from a plan F to a plan G or a plan N. So if you have some of those questions, like Pete was saying, the policy may be surcharged, or they may decline you altogether and you have to stay with what you have or switch to a Medicare Advantage plan. So I hope that answered the question.
Okay, well, thank you everybody for attending. If you have any supplemental questions, please feel free to call our office. Always happy to help. We're going to post this video onto our YouTube channel. So there's an Alpena Agency YouTube channel out there. We'll put it on our Facebook page. So again, if you have friends that couldn't get a chance to watch it, or you thought it was valuable and you want to recommend it to other people, we appreciate that. Hope the information was worthwhile, and I hope you all have a wonderful day.